Hello guys, welcome back to the yet another topic from general surgery. This is the most common case we see in our daily practice in OPDs. Okay, so this is carbuncle. We are going to discuss about carbuncle. तीन चीजें याद रखनी है carbuncle के बारे में. First thing, it is the infection of hair follicle. Second thing, it is caused by Staphylococcus aureus. And third thing, surgery is the only option. Okay, that's it. This is all about the carbuncle. कुछ भी MCQ है ये तीन में से फ्रेम होगा. फर्स्ट थिंग इट इज द इन्फेक्शन ऑफ हेयर फॉलिकल, सेकंड थिंग इट इज कॉज्ड बाय स्टेफिलोकोकस ऑरियस एंड थर्ड थिंग सर्जरी इज द ओनली ऑप्शन. ओके, सो लेट्स डिस्कस इन डिटेल अबाउट इट. फर्स्ट थिंग, व्हाट इज कार्बंकल? इट इज डीप सीटेड suppurative multiloculated infection of hair follicles which involves dermis plus subcutaneous tissue. Okay, so let's break down this definition. Yes, it is deep seated, it is not superficial infection, and we are comparing this with what the most common differential from the carbuncle is furuncle. Now here is the basic difference between them. Carbuncle is the infection which is caused by multiple hair follicles. Okay, so involvement of multiple hair follicles cause carbuncle, whereas involvement of single hair follicle causes furuncle. So let's see. If this is carbuncle, you can see multiple hair follicles which are getting involved. It looks hot, indurated, inflamed, suppurative infection. Okay, and let's look back to the furuncle. This is your furuncle. Okay, so we can differentiate it from the image. Carbuncle is involvement of multiple hair follicle and furuncle is the involvement of single hair follicle. Again, second difference between the carbuncle and furuncle. So in case of carbuncle, there is involvement of dermis plus subcutaneous tissue. So in your skin there are layers. What is the first layer? It is epidermis. Okay, what is second layer? It is dermis. Third layer, subcutaneous tissue. And what is fourth layer? It is muscles. Okay, so it is the superficial most part, so epidermis, then comes your dermis, then subcutaneous, and then muscles. Okay, fat and muscle. Now if furuncle is your infection now, then it is involving your single hair follicle. Hair follicle is get arised from dermis, so furuncle is the involvement of single hair follicle, and yes, it involves only dermis. But carbuncle involves multiple hair follicles and it involves dermis plus epidermis. So this is dermis, this is epidermis, epidermis, dermis and subcute. So all I want to say, involvement of epidermis plus dermis is furuncle and involvement of epidermis, dermis and subcute is carbuncle. So now what is the causative agent of both of them? It's Staphylococcus aureus, and second MRSA. Now what are the risk factors which people are getting affected? Most important risk factor is diabetes mellitus. Here comes your next MCQ. So the first MCQ which we have seen, it is the involvement of carbuncle involves multiple hair follicle, it involves subcute plus dermis, and here comes your again very important MCQ, that is it involves the patient who are having diabetes or uncontrolled diabetes. And what is the causative or the pathophysiology behind that? These patients are immunocompromised. So any immunocompromised patient due to any disease, any illness like AIDS, like obesity. Okay, so these are the risk factors, but which is the most common? Diabetes mellitus. So if you are getting a case of like 60-year-old man having diabetes mellitus and he is having infection at nape of neck. What is nape of neck? Nape of neck is the back of your neck. This, okay, this side is called as nape of neck, and he is having severe throbbing pain. Then what is your diagnosis? They can provide you a classical image. Okay, so what is your diagnosis? It's carbuncle. So what we have discussed yet? Carbuncle, diabetes mellitus, dermis plus epidermis, Staph aureus, nape of neck, and now we will discuss about the clinical features. So as it is infection, it present with severe pain, okay, with the discharging sinuses. So if this is a carbuncle, this is red hot area and there are multiple discharging sinuses, so patient will have throbbing type of pain. And second thing, patient will present with multiple discharging sinuses, each from hair follicle. Okay, now how to treat it? Only gold standard management is surgery. Now how will you operate it? So I am giving you option. Will you aspirate it, or will you excise it, or will you what are the other options? So yeah, these are the two options. So if there is involvement of single origin or the collection of pus is having single cavity, then you can think of aspiration. But as in this case there are multiple sinuses and there are locules in between them, you can't aspirate it. Okay, so what is the only option you have? You need to take cruciate incision. Cruciate incision is the perpendicular incision from the center of the carbuncle, and then you need to saucerize it. What is saucerization? Scooping. Okay, you scoop the ice cream, so you saucerize it. Now you take cruciate incision and you saucerize it. So what is the treatment? Cruciate incision and saucerization. So that's all about the carbuncle. Now we'll discuss about some differentials. Okay, so one important thing, if patient is already in the sepsis, that means if patient present late, then you need to manage the patient systematically. That means you need to start antibiotic, you need to control the elevated sugars, you need to start fluid, and then you will operate the patient. Rarely, but this patient can present in the sepsis if the presentation is late. Okay, now we will see some differentials. So this is the spot diagnosis. What is this? I can see a punctum over here, and this is a swelling. So this is sebaceous cyst. What is sebaceous cyst? Sebaceous cyst is an epidermal cyst which includes the secretion from sebaceous glands. And what is this secretion? It is sebum. It is a cheesy material. Okay, and yes, it have a hallmark of punctum. So if you get any swelling with a punctum at the center, then it is sebaceous cyst. Okay, so how to operate sebaceous cyst? One have to excise it without puncturing it. If you puncture it and if there is release of this cheesy material, if you puncture it and if there is release of cheesy material, then there are chances of recurrence. So here is no role of cruciate incision. You need to excise it through and through. Okay, so now one more thing, will you close the area after surgery? No, you can't close, you can't suture this area because there is involvement of larger surface area in the carbuncle and these two borders can't approximate, and also there is history of infection here, so you can't just go excise and close it. Okay, first thing is because it involves a larger surface area, and second thing, it has the history of infection, so you need to keep it open, you need to do daily dressing, and if the surface area is very large, then one have to perform grafting. Okay, now what is this? This is the classical of dermoid. What is dermoid? Again, it is a cyst which involves epidermal debris, sweat glands, and sebaceous glands. We will not go in details of it, but remember one thing about dermoid, it is present in the midline. Okay, now again we have to excise it if patient is having any complaint of pain due to pressure necrosis and all, but there is chance of infection in the sebaceous cyst, but dermoid cyst doesn't get infected. Now this is your universal tumor, which is lipoma. Why it is called as universal tumor? Anybody? Because it can be present anywhere in the body. It can be present in your brain, in your gut, in your chest cavity, anywhere. Okay, so it is present anywhere, so we called it as universal tumor. Can it get converted into cancerous swelling? No, it is benign tumor. If patient is having multiple such lipomas over the body, then we call it as lipomatosis. Is it necessary to operate it? No. We operate it for cosmetic purpose, but as such there is no surgical indication for surgery. Now, how to differentiate carbuncle, furuncle, sebaceous cyst, dermoid cyst, and lipoma. Am I missing something? No. Carbuncle. So it involves multiple hair follicles and it is deep infection. Furuncle involve single hair follicle. Okay, and it involves only dermis, no subcute. Okay, subcute is involved in carbuncle. Sebaceous cyst. It is a type of cyst, epidermal cyst. It is epidermal cyst which involves sebum. The content of this cyst is sebum, and it originates from the sebaceous gland, and there is presence of punctum over the swelling. Dermoid cyst. It is present in the midline and it involves epidermal debris, sweat glands and sebaceous glands. Last, lipoma. It is universal tumor and the content is fat. It has fat inside it. Okay, and the classical sign is slip sign, which we see in lipoma. What is slip sign? At room temperature, the fat inside the lipoma is at liquid temperature. Okay, so it has a state of liquid, it is not solid. So when you try to grab that lipoma or that swelling, it gets slip between your fingers, so we call it as slip sign. Why it is present? Because that content, the fat is in the liquid state. Okay, so the lipoma is having a slip sign which is absent in all other tumors or the cyst, but yes, it is a classical of lipoma. So yes, that's all about the carbuncle and their differentials. In next topic we will be going to discuss about the burn.